Good afternoon, everyone, and welcome to the Children's Hospital of Eastern Ontario. Of course, a wonderful opportunity today for staff to hear from a trifecta of leaders on Bright Future Unleashed. I'm Sam Laprade, and what an honor it is to come here today. And it's not lost on me that I sort of sauntered up to the building today as opposed to when I'm in mom mode, and usually I'm running to the building. So thank you so much for you being with us today. We have so much to chat about today, and we're going to hear from, of course, all of our leaders today in terms of what the future holds for CHEO. This is an exciting moment at CHEO where clinical care, research, and philanthropy all come together. And we're going to celebrate, of course, because nearly 70 projects were identified in Bright Futures Unleashed this week, and we know that 28 were showcased right here for all of you to get a chance to view and to experience as well. I'd like to welcome all of our leaders here today. Vera Etches joining us today, Jason Berman, and of course, Steve Reed. This is a wonderful time together. These leaders represent the full circle of care, discovery, and generosity that makes a bright future possible for kids and families here in Ottawa and beyond. So we're going to get right to it. Are you ready for me?
Ready.
We're ready.
I think so. Okay. I'm going to ask this very first question. Jason, I'm going to ask you to respond first. The title of this special week, as we know here at CHEO, is Bright Future Unleashed. When you hear those words, what comes to mind for you, Jason?
Well, first, thanks, Sam, for being here and doing this. It's been a really exciting and special week for us. Bright Future Unleashed really marries both the strat plan of the hospital and the Research Institute. Bright Futures is one of the pillars, one of the branches of CHEO's strategic plan, and it's all about innovation, research, quality improvement, and how do we build a brighter future for our children and families. And that really overlaps and mirrors one of the key branches or key roots of the Research Institute strat plan, which is Research Unleashed, which is this idea of having everyone have the opportunity to take their creative spirit, their creative side, and unleash that to try to find solutions for the healthcare problems that we're facing today. And so we sort of have overlapped that, married them together, so that Bright Future Unleashed allows people to share and highlight and showcase, as we saw earlier this week, many of the projects that they're doing. And, you know, Vera and I had the opportunity to chat and walk around a bit together at the fair. And, you know, I was delighted in our conversation that Vera mentioned to me, you know, a lot of the projects that she was seeing, it was nice to see teams that are trying to find new solutions for problems, that are using creativity, that are using AI, that are using technology, that are using research to try to find solutions to the problems we're facing.
Well, very inspiring for sure. I'm heading over to you, Steve. When you hear the words Bright Future Unleashed, what comes to mind for you?
We exist to help, right? So I think we're here to try to make sure that all these great ideas that are coming forward have the resources they need to be properly executed. And so when I toured around the other day and saw all these great projects and all the innovation and all the ideas and the risk taking and all the things that we know are going to take us into the next number of years in the healthcare system, I think that just goes back to the conversations we have with our donor community to say, you know, how can we help make that happen? And you know, so much time is spent managing the day-to-day, getting through the year. We have so much support from our community to help buy the equipment that's needed right now, to help make sure that we are funding the positions that are helping right now. This was just, I think, a great reminder that we step back every now and again and say, what's the future look like? And what can we do to sort of unleash some of the potential that exists if philanthropy can be there to support it. There just isn't the resources to support that kind of risk-taking and innovation without support from the community. So for us and the work that we do with our donors, to see all that work, to see all the ideas, to see all the potential, it just fills us up with all the things that we're now going to go back to the community and say, there's some amazing things happening here at CHEO and the CHEO Research Institute, and I think you want to be part of it.
For sure. It's been an exciting week here at CHEO. Vera, I don't have to tell you that when you hear those words, what comes to mind?
Yeah, you know, I want to start with sometimes here, day to day in healthcare, like we feel what's ahead, right? Because we have space issues, we have staffing issues, and we think, how are we going to keep managing when into the future we see the demand for healthcare keeps growing? And so what I think when I think of Bright Futures is right now today, with the support of the Foundation and the Research Institute, people are testing out new ways of doing things, and they're finding approaches that are going to set us up to be able to improve today and continue to handle and address things into the future. So the bright future is something, we definitely could see evidence of that in the projects that we heard about today. And I think, we can talk more about the kinds of things that we saw. But I was coming into this week having heard from a futurist, so someone whose job is to think about the future and what's ahead. And I want to just touch on a couple of things she said about the future of healthcare. So her name was Zaina Kayat, and she talked about how, today we're quite reactive. People get a healthcare crisis and they come and we serve them. And the future of healthcare is much more proactive. We're predicting who's going to need help, and we're proactively intervening and supporting. And you can see that will start to make things more manageable for our team, but also better care for individuals that are out there. And the future of healthcare, we will hear examples of this, is a more personalized healthcare. And so we're not one size fits all. You come in, same approach for everybody, but actually being based on the characteristics of individuals. So I'm excited that I can see CHEO is navigating these ways and going to be ready for the future. And when I think about that unleashed part, to me, I agree with what was said already. To me, it also means that we're not holding people back. We're thinking about how do we overcome the barriers so that anyone who has an improvement idea can find a way to test that out and be supported. And I think that unleashed part means we see that it's possible for many people to be involved. It's not just for researchers. It's not just about a big project that has to be funded by a research institute. The foundation is here to support small tests of change and demonstrate what's possible.
It's so inspiring. It's so inspiring. I want to hear, because this week, as we know, has showcased some of the amazing, innovative ideas here at CHEO. And outside, you can see the future of pediatric care, of course, being built in real time. I was so excited to walk up to the building today. Can you each share how the tri-organizational model together will help kids now, but also in the future? And I'm going to go back to Vera, and then we'll go to the others. But Vera.
Sure. I wanted to speak a little bit more. I'm not a perfect expert on the project, but I thought it was one that showed that I saw. It was the HEADS ED screening tool. And so today, this is a tool that was developed with researchers, with clinicians at CHEO, people from emergency departments, psychiatrists, and I think pediatricians. So there was that partnership to figure out what's the evidence-based tool. And it also was something where it's basically a screening now for mental health, neurodevelopmental health challenges, and it's helping identify early on. So it's for under age 6. So we hear about youth, teenagers, older, trouble, challenges. What if we started early and we intervened early? And so then I think of the link to the foundation, where, Steve, I know you have been cultivating relationships with people who care about early infant mental health, and it's leading to new programs, early connections. Really are actually delivering care in a new way. I've been there. I've seen they have headsets. They're coaching parents as they play with their kids. That wouldn't have been possible without the foundation. And so it's like joining these pieces up, where we see the need, we work on the evidence-based approach, we have the support from funders. That's, to me, what this is. This is why Team CHEO is so strong.
Team CHEO, absolutely. What are your thoughts, Steve, in terms of this new way?
I think the thing to remember is people want to help. I think there are people out there that want to see these kinds of innovative ideas and solutions that are going to help the healthcare system thrive in the future. They want to help, and so they're looking for us to create those ideas, and then they're there to support with some resources. I think when you asked about, how do we make sure that this is a cycle that works well together, there's so many great examples of where a funder has come forward to put a program in place that at least gets it started, and then that might lead to some funding down the road. If it's on the research side, it could be the thing that is the catalyst for funding grants. If it's on the hospital side, it could generate the evidence that's needed for this to go to a proposal to the ministry for future base funding. So all of this is just a cycle that continues and continues. It's hard to even know where to begin because it is a cycle, but if you can imagine a funder coming forward with, and when I say funder, it could be a corporation, it could be an individual, it could be an association. These people, these organizations exist to help. And if we can provide an idea and put it in motion, that might lead to some change in clinical practice. That might lead to a need for some new equipment, and others might come forward to support with equipment. And eventually that creates a virtuous cycle that I think explains exactly how we work so well together.
Mm-hmm. Jason, I'd love your thoughts as well.
Yeah, so this is really all about innovation, and this is this unleashed idea. There's an innovator in all of us, and through Vera's support, through Steve's support, CHEO has created a fertile environment that really enables people to be innovative. When we think about other things in our life, we don't do anything now the way we did 5 years ago. We don't book flights the way we did 5 years ago, or make restaurant reservations, or even do Christmas shopping. It's done online, it's taking advantage of technology. So why wouldn't we want to embrace that technology and bring that into healthcare? And we're doing that in many ways. If I think of our core innovation group, which is our core that bridges discovery research and industry, working with a number of different organizations. We have a project, RX Food. This is working with our dietitians in the hospital who are looking at trying to do calorie counts on patients to be able to prescribe the right nutrition and care is. That's a very challenging thing to do the old way with getting histories from families. We also have a very multi-ethnic community with all sorts of different foods. RX Food has created an AI-based technology where you can take a picture of the meal and it will calculate your calories. So this has allowed for a much more accurate and predictive way to be able to make those sorts of assessments. If we think about the keynote speech that we heard the other day from Drs. Hannah Alazam and Anna McCormick around bringing in technology to help with mobility. Kids that in the past were told they wouldn't be able to walk, now with robotics are able to move, are able to communicate. We saw technology at the fair where just by thinking with their brain, I think, Steve, you tried some of this technology. Just by thinking, you could move things around on the screen. This is giving mobility and freedom to kids that previously never had this. And the new building that you see out front, the Integrated Treatment Center, is going to be an opportunity where we can bring this technology, bring this innovation to life in a space where families can get all their care in one place. So I think that's really exciting.
It is so exciting. It's so exciting. So among the incredible work happening here at CHEO is the world's first Think Rare algorithm. What is it, and how does it improve the lives of children, youth, and families? Vera, do you want to take that one first?
I feel like Jason might be in the better place to explain what it is.
Yeah, sure.
What I understand it has meant for families is that rather than trying to figure out what is the cause of this difference in my child, why are there challenges with something, or going to many different healthcare providers, different specialists, different examinations, being able to have some flag early on that maybe this is a situation where genetic testing would help bring a diagnosis. It just shortens that journey so that the parents and the families have some explanation. Instead of, sometimes we hear families, they wonder, is it something they did, and just lifting that sense and having an explanation and then having the ability to get care. Because sometimes your care is dependent on having a diagnosis. So this is my understanding of what it means to families, and shortening the amount of traveling around through our healthcare system as well.
For sure.
Yeah. But how it works.
No, Vera, that's exactly right the way you described it. I mean, families will talk about going on this diagnostic odyssey, and we've met families that have been one of the first families that was put through this Think Rare program. They had a son who was 17, and over the course of the 17 years of his life, I think went to, no fewer than 350 different specialty appointments, visits. And, often we try to be integrated in healthcare, but often things become, siloed with different specialties focused on their particular areas. And what Think Rare did is it really married the expertise that we have at CHEO in rare genetic disorders, led by Dr. Kim Boycott, our chief of genetics, our electronic health record. We were the first hospital to invest in EPIC, so taking advantage of EPIC and the wealth of information that's in that electronic health record, and AI, and pairing our data AI scientists with our geneticists, creating an algorithm that could help identify which patients would benefit from having genetic testing, having whole exome or whole genome sequencing. And through that, to date, we've identified, I think, 17, 18 patients who now have a diagnosis, as you said, have a name they can put to this, can get the resources, can have genetic counseling and testing that they need. And the feedback that we've had from families is it's been a total game changer. Because as you alluded to, they blame themselves, they haven't understood this. Their child, has been able to say, oh, this is the reason why, I'm not as good in math, or I can't run as quickly, or I have problems with my vision, or whatever the situation may be. So that's really been very helpful. And what's really neat about this is what started as a research project, again, through funding by our donors through the foundation, is now part of clinical care. So it's now part of EPIC. It comes up as a notification in the chart, just like an allergy would or some other notification. And then the clinician can decide in consultation with the family whether they want to get genetic testing. And this has been so successful that we've had a number of other hospitals across Canada and around the world, as far away as Australia, reaching out to us who are interested in how they can adopt Think Rare to their institution.
Wow, it's so exciting. If there's one thing I know about fundraising, Steve, when you can say it's the world's first and it's something that potentially is going to be, something that is spread right around the world, like we just heard from Jason, from a fundraising perspective, that energizes donors. And I'm sure all of the team that's listening today would energize them because they're getting the tools as well, the wonderful staff here at CHEO.
Oh, it sure does. And I think if you put yourself in the shoes of a donor who has the capacity to make a significant gift to us or to anyone, and they're looking to see where does that investment make the most sense. These are the things that get people excited, right? This is not just sort of helping kids through the system here at CHEO, but it's changing clinical practice across Ontario, across Canada, and potentially around the world. So if you're looking to make a big impact, these are the kinds of things that are really exciting to donors and make it exciting for us to be able to show what we can do here at CHEO. What's, I think, really exciting about the Think Rare program, other than its obvious outcomes and the benefits of the outcomes to the families that are affected by it, is the way it happened and the way it came to be. And it really got its roots in the Care for Rare program, which was initially donor funded. So somebody way back had a really exciting big idea. There was a donor that was able to support that idea. That led to, some ongoing funding and some support that led to a big program here at the Research Institute that ultimately attracted researchers and built the program up so that now we can marry that up with similar expertise in AI and look what we're able to do. But it all got its roots in somebody having a big idea and somebody supporting that big idea from the community.
Mm-hmm. I love big ideas.
Yeah, if I can add, that's been a real joy for me coming into CHEO, is to realize there is this kind of group of people who want to make a difference, who are just a little outside of the day-to-day pressures, who have good ideas, and it's worth thinking about how they fit and advance. And I think that the thing I'm excited about with the Think Rare sort of is that it's helped a number of families significantly, and it's showing what's possible with more data analysis and the use of AI within the information systems we have. So I really think this is just the beginning, because you can imagine the information we have, it could probably be used in more ways to link people to that personalized support system in the community, identifying not only the need for genetic testing, but what are the best supports, what are the best pathways. So I'm quite excited that this is really just the beginning of that kind of work.
Beautifully said. This next question is so close to my heart. And I look at all of you, I've interviewed all of you so many times, I'm sure Vera remembers me calling her 852 times during the pandemic. Mental health is such an important topic and issue. And with our young people today, there is a youth mental crisis. There's mental health crisis. There's no two ways about it. Demand is high, requires new ways to deliver the care. What's the current outlook at CHEO, and what's being done to evolve that mental health help and support within the community?
Yeah, I think you're right, Sam. If you look at the data, and I call up some public health data, because it's about our whole population is seeing this. When you look at the student substance use and health survey in Ontario, here in Ottawa, if you go back before the pandemic, it would have been about 20% of youth between grades 7 and 12 that said, really, my mental health is fair or poor. In 2021, in the depths of some of the challenging times there, 44% of youth grades 7 to 12 said, my mental health is fair or poor. And we've seen some improvement since then. So in 2023, it was 37%, but that's more than 1 in 3. Mm-hmm. And that's definitely not where we want to be. Our youth are the next generation. We need to have them seeing the way forward and building on their positive mental health. I'm learning about what CHEO is doing, and I'm really encouraged because during the pandemic is a good example. They saw the increased pressures, for example, for eating disorders on the eating disorder program, and they were innovative and thought about, well, can't bring everyone in. We don't have enough space. It's a theme. And so what can we do that's a partial hospitalization program? Using the tools of research to evaluate it, linking it to funders who really care about this issue. And they've set a new standard and a new way of caring for more youth, through partial hospitalization. And now they're exploring that for other mental health challenges, right? So it's just, to me, it's evidence of what happens across CHEO more broadly when people are thinking about, the needs in our community. How do we keep adapting? How do we meet them? Another example on the mental health front, which I have really appreciated, been able to tour through, is the mental health transitions unit. Mm-hmm. And so it's recognizing, the current way of coming into our emerge department isn't ideal when people are having a challenge with mental health, and creating another place where people can be supported, be triaged into some short-term support. And maybe the hospitalization is really always something we're trying to prevent for children and youth, but having that short-term help to get the connections to the community supports established really well, because that's the key, right? People need help in the community. They can't be with CHEO for too long, and ideally, we're supporting the community connections. So that's that. These are things that have been built, and I know the team still sees gaps for sure. We hear it and feel with really significant mental health needs, externalizing behaviors. There are some things that we still need to build more solutions to, and I think that's where I see CHEO using the evidence and advocating, raising the issues to the attention of those who can fund them. So that's also part of our role.
Mm-hmm. I mean, I think, about my generation, Steve, I never even heard of the term mental health. And I think about how far we've come. And so it does excite me in terms of the fact that we even talk publicly about this. Yep. But we've come so far. And we know that donors have an appetite as well, and they like to share their stories because their stories is why they're giving. We want joyful giving. Yep. And when they can feel like they're solving or helping to solve some, mental health crisis for someone in their community, it inspires them to keep giving. Are you and your team seeing that type of rallying around this program?
Certainly. I think not only has mental health become a big concern inside the walls of CHEO, but it's also a big concern in the community. Mm-hmm. And so we more and more, and as you say, it wasn't that long ago when most of the community support might have, been targeted towards other disciplines and other areas of concern, but more and more, as I think an awareness is growing about I'll call it a crisis in mental health, has become more accepted and understood by the community. They're looking for ways to help, and I think they're helping on a couple of, it's useful to think of it in a couple of different ways. There's help being provided to those that are navigating the system today, and so we've been very proud to be able to work with CHEO at times to say, you know, we need some help over here right now. Is there something you can do to help? And we've either had resources or we've been able to pair donors that want to help up with specific projects or positions that need to be put in place and that sort of thing. So there's the immediacy of we need to help the people that are in it right now, but then there's also, it's a growing area of interest for those that want to make transformational gifts towards research and really make sure that there's you know, a better future ahead for the mental health area as well. And so we've been very lucky to have some very large transformational donors who are looking to us to do some work in sort of creating a better future for caring for people with mental health issues. Yeah.
For sure. And the impact, Jason, of the Precision Child and Youth Mental Health, from a research perspective, you must get very excited about this opportunity.
No, absolutely. You know, it is an area that, you know, frankly, just, you know, as was mentioned, wasn't addressed in the past and really didn't get the attention from a research perspective either. And we were very fortunate in terms of a transformational gift to establish the Precision Child and Youth Mental Health, now what we call a collaboratory, because it's a very collaborative group of individuals working with a team. This was funded through exclusively through philanthropy. And it's taking that precision lens that Vera referenced before of sort of the right care, the right time, sort of which we've derived from sort of other areas of medicine. We tend to think of precision health more maybe in oncology or genetics, where we're identifying a gene and a specific treatment, but applying that more broadly in mental health. Often some people will say from the genetic code to the postal code, how do we really deliver the specific care services that we need to patients with mental health? How do we do earlier detection, whether it's in eating disorders or mood disorders, to be able to pick those conditions up earlier, intervene before they become more serious? That may use genetic techniques, that may use other biomarkers, and bring that all together to be able to deliver precise mental health care. And I think that's really important. You know, we don't, in all other areas of healthcare, nobody wants a one-size-fits-all solution. It really needs to be tailored to you know, that unique individual, and that's what we're trying to do through the PCYMH Collaboratory.
And I'm just going off script a little bit, but I wanted to just talk a little bit about how everything we've talked about so far, what keeps coming into my mind, because I know how healthcare works, is you are putting in the hands of all of the people watching us today, working hard, maybe watch this a little bit later today. Mm-hmm. You're putting into the hands of all of these dedicated professionals the tools, the research, everything they need to do their job even better. I mean, I know you're relatively new in this role, but that must excite you as well in terms of, you see people, you've talked about space a couple of times. This is the kind of thing that would get me as excited as a leader.
Yeah, I think that's our goal, is that everyone will have the opportunity to contribute, and we're building towards it. So I think the examples and the things we see today are showing what's possible, and we're learning, right? Like, what is it that makes it possible for somebody to say, I think, for example, I think we need to make sure we improve how parents get the right teaching and training so that they can be successful when the family is discharged from the hospital. And nurses noticing that's not happening, and it's a risk for people to return. And so then thinking about, how can I understand what the barriers are? How can I reduce those barriers? How can I evaluate what's worked? So I think it's starting to show that these are ways we can all start to approach our work.
That's very exciting.
And research and innovation bring hope, right? Like hope to patients and families, but hope also to providers that, you know, we've been doing it this way. It's worked for a lot of people, but not everyone. But now with research and innovation, we can do it differently. We can come up with different solutions. And, you know, I keep coming back to technology. It's not the answer for everything, but it is the answer for many things. It allows us to do things in ways that we can't. It allows us to access our remote communities in ways that may have been more challenging, to be able to deliver care closer to home, because we have technologies, whether it's video consultations, whether it's other wearables, those types of things where we can get feedback and and be able to share those with local care providers so that our patients in Nunavut and Northern Ontario and Western Quebec maybe don't need to come to CHEO all the time. That also helps with some of the space pressures, but also is better for patients and families because they get the care in their communities.
I always think research, I think you taught me this actually, research today, solutions tomorrow, right? I love that. I love that so much. Okay, I want to take a deep dive into, in your own words, why do you think nursing research is long overdue, and what opportunities will they provide in the future of pediatric care? Jason.
Yeah, so I'm very excited about this, and looking at one of my nursing research colleagues, Dr. Christina Canton, in the audience who's with us today. You know, I think when people think about research, there's still a bit of this vision that it's like some white-haired, mustachioed guy in a white lab coat with a bunch of test tubes. And of course, that is important research. We do have some white-haired people running around upstairs, but research is much broader than that. And it goes beyond medicine as a discipline to nursing, psychology, social work. I gave the example before that our nutritionist doing research. Really, we want to be able to provide a home for research across all these disciplines. And we've had a focus on nursing research for the last couple of years. And this has been a really true partnership between the Research Institute, Tammy DiGiovanni, who's our chief nurse and executive VP of clinical services, as a nurse herself, recognizing that nurses want to do more than just provide direct clinical care. They want to, like their physician colleagues, find solutions, try to improve care, find quality improvement. And so through that, we've built a program where we had a research chair, Dr. Rochelle Einboden, who came back to Canada from Australia to fill this position, and that's done jointly with the University of Ottawa, the CHEO Research Institute, and CHEO Hospital. We then were able to recruit a nursing scientist, Dr. Christina Canton, who just defended her PhD, to come and work in that team. Together, they were catalysts for other nurses. We had a nursing internship program, so we've got a number of nurses that are now in training, learning how to do research projects, doing advanced degrees, masters, and PhDs. So we've really built up this whole network, and we're moving towards a center of excellence for nursing research. And we're going to have the opportunity, we had some of the nurses displaying some of their work this week, but we have a nursing research conference, the first ever that CHEO has hosted on October 17th, where we'll really be able to showcase the tremendous work that nurses are doing. And again, part of the importance here is that nurses, like their physician colleagues doing research, they know the problems that they're seeing at the bedside. They're informed by their patients and families, and those are the problems they're trying to solve. And who better to do that than the people that know those problems best, because they're seeing that in their patients all the time, whether they're a NICU nurse, a PICU nurse, an emergency department nurse, a hematology oncology nurse. They're addressing all the concerns in that population. And so we're really excited to, again, create the fertile ground, the infrastructure to support that.
No, it's very exciting. And, you know, the opportunity to share this perspective from a nursing perspective with donors, Steve. Tell me how that's going, and tell me a little bit about that perspective for you.
I think it's just another example that we can use of some big thinking here, that if people are looking to make a difference long term, if they're looking to us to sort of demonstrate how an investment in CHEO is a good investment, and that there's examples like this where we can say we're going to use our expertise in research, we're going to look at nursing, and we're going to use evidence-based practices to make sure that we're advancing care and that we're doing the things, we're using our resources wisely, we're doing the things that would say to somebody that might not understand the details of healthcare, this is a good investment, they're on the right track, they're doing the things that we'd like to see happen in healthcare for our kids of the future. And so this is, I would just treat this as one of many, many examples that we can put in front of a donor of how we're not just trying to get through the day, but we're also looking at what can we do to advance care going forward. One of the donors that we work with, one of the larger donors, actually the one that was supportive of the PCYMH investment, she uses a term called catalytic philanthropy, meaning she's trying to find things that allow new ideas to come forward, trying to make space for research or the thinking or the risk-taking or whatever it is that's going to take our current environment and make it better for the future. There's a lot of donors that need to help us just make sure that we're getting through the current environment and helping families navigate the system that we have now. But then there's another group of donors who are equally interested in making sure that that system improves over time. And if we can show some examples like this where we're participating in that improvement, these are things that are very appealing to some of those big donors.
100%. Yeah, no, it's very, very exciting. I'd love you to look ahead with me and think about the emerging areas of pediatric research and innovation, and what do you see as the most promising transforming care in the next decade? Let's think ahead to 2035. I just figured out how old I'm going to be then. That's okay. But Jason, I'll start with you.
Yeah, so thanks for the opportunity to talk about that. I mean, we've talked about AI already, and I think, it would, I'd be remiss if I didn't say that I think the way we deliver healthcare now, over the time period you're describing, is going to be really revolutionized by AI. I think AI is going to revolutionize the way we do things in much the way that, that the internet did before. Mm-hmm. If you describe to people that, 20 years ago that we're going to be, watching videos on cell phones and talking to people, and actually from a clinical care perspective, I can get my patients' labs on my cell phone, communicate with the nursing unit when I'm in a meeting somewhere else, they would think that that was science fiction, and it was then, but now that's a reality, and it's actually improved the way that we're able to deliver care in a more effective, timely, and actually more secure manner. And I think AI is going to do that as well. AI gets a bit of a bad rap because, the name is bad. Artificial, people think artificial is a bad thing, and intelligence sounds like it's being, kind of negative, like, it's more intelligent than you are. And I was just recently overseas at an international conference where they talked about the fact that it's healthcare intelligence that's both artificial and human. So it's how do you bring the human and the artificial intelligence together to try to solve those types of solutions. And I gave some examples before. We're seeing that in some research projects. We've already seen with ThinkRare how an AI-driven research project can go into clinical care. And we have numerous other examples of how we're going to see that, how we're going to be able to get information, how patients are going to be able to be informed. So I think that is going to be key. Another area that I think is going to be really important is clinical trials. And so we're in the process right now of constructing the first clinical investigation unit, CIU, at CHEO. And this is going to be an opportunity for patients to be able to enroll in clinical trials locally, so they're not going to have to travel as far. They're going to have access to be able to participate in new treatments, exposure to new devices, new biomarkers, participate in that type of research without having to travel far, having that right here at CHEO in Ottawa, which I think is going to be really helpful, because that I think is going to be transformative, because as you've said, the trials that we do today are going to inform the treatments of tomorrow.
100%. Steve, where are we going a decade from now with the wonderful CHEO Foundation?
So the neat thing about being part of a foundation associated with the work that you're hearing about today is we've got a big job just to keep up. Like think of the work that Jason's team is doing. Think of the work that Vera's team is doing. They are thinking big. They are trying to create a much better future for kids and families. And so it puts us in a really neat position where we get some great stories to tell about how that's going to take shape over the next number of years. And every time I talk with either Vera or Jason, I pick up new things about the work that's being done at the hospital, at the Research Institute. Our job, and it's such a privilege for us to be able to sort of sit in the middle of an amazing dynamic where all this work is happening here. There's people in the community, companies in the community, organizations in the community that want to see that happen and want to help. So it puts us in this great spot where we can just sort of connect the dots and connect people who want to see that work take place and have the means to support it. And so I guess our job over the next little while is make sure that we're telling that story and that we're communicating that in a way that makes everybody understand how important it is, and B, what these solutions are. So that's given us some license to do some new things. We're doing some more and different marketing. We're reaching different people in different communities. We're making sure that we understand that as the population grows here and the catchment area grows beyond just Ottawa, that we're connecting ourselves with donor communities outside that aligns with the patient population as well. And we're having some success with that. We're finding that people in outlying areas understand that CHEO is important to them as well. Certainly when it comes to research, there's no boundaries really. This is something that is affecting practice across the country. So when we get the chance to tell those stories and can connect people that have an interest in supporting it, it's why we enjoy what we do.
And can I just give a shout out to you and your team for Kids These Days? that campaign, so brilliant. And what I love is I recognized people in that campaign. So talk to me a little bit about it, because I thought it was so brilliant.
Yeah, well, thank you for that. It's working well for us. I think it's achieving what we wanted it to achieve, which is giving us a platform to tell the story of the work that you've heard about today. The real premise of it is, I guess, an understanding that the world is very different for kids these days than it was when CHEO first opened. Right. So all these changes you're hearing about, all the evolution that we're in the middle of making happen, this is to recognize that the way we care for kids has to change as well. And so far that campaign has done a good job of getting that message out. It seems to create conversation. It seems to give us some opportunities to talk more to people about what we mean by what they're seeing on TV or in the ads. But to your question, I think what you're asking is the characters, the actors. They're not actors. They're kids. These are all kids that are CHEO kids. All the clinicians are CHEO clinicians. We made that a premise right from the very beginning. That was a principle we wanted to hold to. There's nothing about those ads or commercials that isn't 100% authentic.
I love it. So well done. So well done. Okay, Dr. Etches, you and I are going to meet here in 10 years from now. I'll buy the coffee, okay? Where's CHEO at in a decade?
Yeah, it's so exciting. I think some of the tools that Jason alluded to, they just open up a lot more possibility for people to have access to the expertise of CHEO, even from their homes, right? And so I think in 10 years, we're going to really see that joined up data where kids and families are the custodians of their data. They are using the information from continuous monitoring, or it's like, oh, I have to wait to have an appointment in a year. It's like, oh, they're getting the message. This looks like this isn't quite as expected, and that's going to their primary care provider. Their primary care provider is able to intervene early because we're supporting them. And if they have a question, they can get access to a community-based pediatrician really quickly. And then there's the expertise here at CHEO, so that we'll see the people who really need our care are here, but a lot more care in the home and in the community, out of the kind of access to and support that comes from CHEO, I think is a big part of that happening. So I saw, again, like today, I see this starting, right? I see people here at CHEO were asking, could this chemotherapy happen without a hospitalization? And then they show it can, and they evaluate it's safe, right? So they're starting to really question and think about, how can we help kids be where they want to be, which is with their family and their friends. So I think that that tailored care is important. It will be based on individual health metrics, but it also individual and cultural needs. I think we'll see a real shift in terms of community continuing to inform CHEO.
It's so exciting. It's so exciting. I feel like I'm marking this day as well, just knowing what's coming up. So it's very exciting for me as well. We really want everyone to participate as well and share their thoughts about today, about Bright Future Unleashed. We want everyone to throw those words in a word maybe that inspired them today into the chat. We're going to create something and share it with the team as well, as we sort of reflect, because even I noticed little light bulbs going off for you all when your colleagues were speaking. So I'm going to start with you, Steve, no pressure. But after even our time together today, is there a new word for you today?
A new word? Oh, I don't know about a new word, but I will say that this is very typical. When I have an opportunity to speak as a group like this, I always leave with, oh, now we can talk about this. No, I didn't know that was happening. Well, I know somebody that will help us with that. And so I think at the end of the day, this is exactly why we wanted to make sure everybody understood how important it was that the three organizations work so well together. It's necessary. That's how things get done. I'll go back to Jason's first word about hope. I think that's the word that comes to mind for me. We're very hopeful. I think there's a lot that tells us that there's work to do. There's a lot of hard work ahead. There's some bumpy roads, I'm sure, as we navigate the different funding systems and that sort of thing that we have. But there is hope. There are people out there that want to help us, and our job just is to get that message out and make sure that we connect those dots.
Any last thoughts for you, Jason? Any words that come into your mind to leave us with today?
Yeah, I think the word I would take is I would sort of steal the word collaboratory from the Precision Child and Youth Mental Health Group, that, you know, all of CHEO really is a collaboratory. And, you know, it's a play on collaboration and laboratory. This is a place that people can do new things, that people shouldn't be scared to think outside the box, that, you know, leadership is encouraging innovation. We're trying to make space for it. We're trying to fund and support that, because obviously lots of innovation requires seed funding to do a pilot, to test that. And so really all of CHEO is a collaboratory. The three of us collaborate exceptionally well together, and we want to bring the community together to try to solve these problems that really none of us can do alone. We really need to work as a team.
Last words to you, Vera.
Yeah, I think you can see it, right? The future is bright.
The future is bright.
That's the theme. And it is something that inspires and gives hope as we continue to tackle things each day.
Absolutely, absolutely. Well, thank you so much for your time today. Really appreciate the opportunity today. And thank you so much for our team that was here in person to hear all of this today as well. And for all of you watching, maybe from your desks or your phone, as we didn't think could be done 20 years ago, we do appreciate all of you joining us as well. We know that today was how we saw care, research, and philanthropy all come together to create a brighter future for kids and families, and it's only the beginning. I'm Sam Laprade. Thank you so much, everyone.